stayed great. You know, when we got to the hospital, I mean, you wouldn't have known I had been in labor that long at all. So, you know, if you get anything from tonight, you know, the main message is your body has so much potential. It is so able to give birth. It's so able to give birth naturally. And, you know, oftentimes we just aren't given the chance to allow our bodies to show us what they can do. And so just remember, there's a lot of things out there that you can use to support your body and allow your body even more to do, you know, to express its full potential through chiropractic, homeopathics. You just have to ask for some help.
Do you recommend, is it a good idea that pregnant women have an adjustment towards the end of their labor? I mean, pregnancy? I know it's probably good, like throughout the whole pregnancy.
It's good throughout it, yeah.
If they can only afford to go a couple times.
Go at the end.
At the end.
Mm-hmm.
Okay.
Yeah. Yeah, definitely.
Okay. I mean, because, you know, if there's a posterior baby, and they see a chiropractor towards the end, there's a much more likelihood that the baby will change into a better position to avoid the back labor thing, possible C-section thing.
Right. Yeah. I mean, you know, with my labor, I mean, I had just what I do for a living working against me, but I mean, I had a lot of emotional issues too that I know were blocking the labor, and that was something that Dr. Jennings came and worked with me. But there are so many people, you know, people that are my patients, like I said, chiropractic wives and things that, you know, they end up having 5-hour labors, 6-hour labors. You know, one of my patients, her first baby, she had a 6-hour labor from start to finish. So, you know, if you do things to really support your body and help that baby get in the proper position, boom, you're golden. Your body can really,
or not.
really
I've seen people who every day or night they are sitting in reclining chairs watching TV, and they have. It's not unusual for them to have posterior babies.
It's just gravity.
Yeah.
Yeah, I took off work 2 weeks before he was born, and I was bored because I'm so used to just going, and I was stressed because my office is sitting there without me, and so I ended up sitting in the recliner watching movies, and you know that's part of what caused him to get in the wrong position, and I just had stopped thinking as a doctor and wasn't taking good care of myself. So. Yeah.
I'm sorry, I'm asking.
No.
Go ahead. I want to ask one more.
Do you do anything with like, I know someone who lives in Merrillville, and actually their baby had seen Dr. Jennings, but he banged his head all the time. And he did cry a lot, and he had like recurrent ear infections all the time. But like I said, they had been to Dr. Jennings, but they ended up taking him to a cranial osteopath.
Okay.
Something about how the baby's head molds during labor.
Yeah.
And they thought maybe that's where like he was actually in pain because.
Absolutely. If a baby's banging its head, that's a sign that you've got a problem with the cranial bones. And I'm glad you asked that question because I forgot to mention that. Another thing that I can do with infants is work on those flat spots. You know, because they want us to keep our babies on their back more, we're getting kids with all these weird flat spots, which is also really damaging to their development. Infants, just through the cranial or the birth process, you know, their head has to kind of collapse down, and then as they nurse, and just from pressure changes of now coming out at birth, it starts to blow back out. But if the birth process was especially intense on one side or another, you can get a lockage. So yeah, you have to release that. Dr. James, I'm trying to think, he's adjusted Michael a couple of times. I don't think he does quite as much cranial work as I do. Every once in a while, there's something that I do a little more, but you know, he hasn't done the pediatrics of pregnancy diplomate program. I think he definitely. Is that answering your question? Definitely,
Yeah.
You know, if a child's doing something odd.
If some chiropractors did do that work also.
Yes. Yes. And that's one of the things that I do. is